Hey, it's Dr. Giganti, founder of the Back Pain Center and author of Hope and Help for Back Pain. We're going to look at some flexion exercises, exercises that typically are incorporated by the patient that has, as an older patient, patient that has more degeneration in the spine, the patient that likes sitting more than walking, the patient that has disc degeneration, the patient that may have spinal stenosis. Okay, so these are exercises that are friendly for that type of profile. One of the things we wanted for that type of patient, by the way, we talked about the sacroiliac. If you are a flexion or extension, the sacroiliac can apply to you. So if that seems to be part of the problem, you can incorporate that first. However, once you feel like you've done that correction, you can do flexion type exercises. One you can do is a knee chest. Knee chest is where you can hold this and pull one, that type of thing, and then come down and you can alternate, go to the other side. Okay. And then you're gonna go back and forth. You wanna hold 3 or 4 seconds on each one of these and come back and forth, okay? This should not be painful. You can do a knee chest with a crunch, and this is where you come up, hold 1, 2, 3, 4, 5, and go down. You can do 5 on one side if you want. You can alternate. And then when you're done with this side, you can put this leg down and do this and do more crunches on this side. Good exercise, okay? So that's your knee chest with the crunch. You got a pelvic tilt. The pelvic tilt is where you're gonna push your low back into the table. You're gonna flatten your low back. Let's exaggerate this way. So you come on up. So you want to do just the opposite of this. You want to push, yeah. So you're pushing your belly button down. Okay, you're gonna flatten your back out and open up the spine. Again, 5 or 10 of these. Sometimes small amounts done frequently throughout a day is better than just doing a lot in the morning. So if you're in a lot of pain or it's chronic, you may want to do a small amount, 5 or 10 in the morning of each. And then in the afternoon, and then at night. So the next we're gonna do is bridges. You wanna come up, okay, and do a bridge. Come on down. Now, if you're a flexion patient, and one of the things, again, the flexion patient, arthritis, degeneration, you like sitting better, all that stuff, you want these muscles to be stretched. So if you bring your feet as close to your butt as possible, when you come up, not only are you doing some exercises, you're going to find some stretching in here that should be beneficial for you. So do that, hold it up for 5 or 6 seconds, get these stretched, and add this to the repertoire. Then you got a single leg bridge, and that's where you come up on one side. Now, if this may be too painful, so in that case, I would just leave one leg down and up. Okay, so if you bring up a leg, it might be a little challenging for you. I would just keep that leg down and bring. So this is like the hip hike, but a slight variation where you're not doing this turnover. So you're just gonna come straight up and down, get 5 of those, and then you're gonna do the other side, okay? And just up and down, up and down, okay. The last one, and by the way, there's tons of other exercises. These are key ones that we've kind of trimmed down to being the most effective for your condition, again, that you can do in a relatively short period of time. So the other one you want to start doing is a seated stretch where you come on up. Okay, you got it properly, like that. And what you're going to do is you're going to start touching. You're going to stretch your back out. You want to come down forward and you want to stretch. Again, you're going to come forward, hold that for 3 or 4 seconds, 5 seconds. Some people require 10 seconds, and then come back up again. Go down forward, touch, and stretch. Okay, get this worked out. All right, so this is a repertoire you can do. Remember, if you feel like you have the sacroiliac component where you need to do the hip hike, you want to do the hip hike first and then follow with these exercises which will reinforce the correction. So I hope you find this helpful, and we'll talk to you soon.